In the mid-19th century, the American medical profession was a fiercely guarded, aggressively exclusive fraternity that viewed the idea of a female doctor as a literal, stomach-turning joke. Society firmly believed that women were mentally fragile, biologically inferior, and emotionally unsuited for the gruesome realities of medicine. But one fiercely determined immigrant named Elizabeth Blackwell was about to shatter that glass ceiling into absolute dust. Born in England and raised in an abolitionist American household, Elizabeth's ultimate turning point arrived when a dying female friend confessed that her agonizing suffering would have been vastly mitigated if only she had been cared for by a female physician. That profound moment of raw human empathy sparked an unyielding, lifelong obsession. Elizabeth Blackwell vowed to become the first woman in modern history to earn a legitimate professional American medical degree. The road to this historic triumph was paved with relentless humiliation and a shocking twist of fate. In 1847, Elizabeth systematically applied to nearly 30 medical schools across the United States, facing aggressive rejection letters that told her to either disguise herself as a man or give up her absurd dream entirely. Finally, an application reached the small, conservative Geneva Medical College in upstate New York. The administration, completely terrified of making the controversial decision themselves, put the choice to a democratic vote among the 150 male medical students, declaring that if even a single student objected, she would be rejected. Believing the application was nothing more than a hilarious prank concocted by a rival school, the entire rowdy student body unanimously voted yes. When Elizabeth actually showed up on campus a few weeks later, the school was trapped in a stun lock, forced to honor its own accidental, historic invitation.
Inside the classrooms, Elizabeth faced a grueling endurance test of isolation and open hostility. Professors actively barred her from attending anatomy lectures on reproductive health, claiming it would shock her delicate female sensibilities. Elizabeth fiercely refused to step aside, delivering an articulate, unwavering defense of medical science that shamed the faculty into letting her stay. She pulled relentless 90-hour study weeks, outperforming every single male student in her class. On January 23, 1849, the ultimate breakthrough arrived. In a crowded commencement hall filled with a mesmerized, shocked public, Elizabeth Blackwell graduated at the absolute top of her class, receiving her diploma directly from the college president, who publicly bowed to her in deep, profound respect. The ripple effect of her historic triumph altered the trajectory of global healthcare forever. Elizabeth went on to open the New York Infirmary for indigent women and children, creating a pioneering institution staffed entirely by women that provided critical medical care to the city's poorest families while training the next generation of female physicians. During the American Civil War, she organized the Women's Central Association of Relief, systematically training thousands of union nurses to save countless lives on the front lines. Elizabeth Blackwell single-handedly broke the medical glass ceiling, proving to a captivated world that true genius knows absolutely no gender, permanently changing the face of American medicine forever.